Hello guys and welcome back to my channel. So in this video I'll talk about the practical approach for the final MD and DNB examinations. So basically I'll first start off with the marks distribution. So we have the clinical problem basically out of 20 marks, and we have the hemat slide staining for 10 marks. Clinical pathology basically, which is your urine, for 30 marks basically. Then you have the clinical hematology, in which you need to do the PT, the comb test or the blood grouping, which means it is which is equal to 20 marks. For grossing you have 20 marks. For post-mortem you have case-based approach, which is again 20 marks. Basically this you'll be asked questions on these topics basically. Then for OSPE you have 25 marks, and for HP slide preparation and staining you have to do it yourself, so 10 marks. For micro teaching you have 20 marks. For grand viva you have 80 marks, and you have got basically these slides. So for hemat and cyto you're going to give it in one day, so 11 slides, 55 marks. And for HPE you have basically 14 slides of 5 marks each, so 70 marks. And for thesis you have 20 marks. So this is basically the marks distribution in my college, but I'm sure this may not be universal. You may be having different marks distribution for your particular college or for a particular state. But what I'm trying to tell you is that I'll talk about the components of the practical examination that you have to read, and those components are basically universal. So all around the country you have to read these particular topics for your practical exam, so that is universal. But the marks distribution I have just given you so that you can have a reference. Now I want to tell you that in micro teaching you will be actually making a PPT and presenting that in front of your teachers, your external examiners, and they will judge you based on how you are able to explain, how you're able to communicate and ask questions to your students. Basically your skill of teaching, they're gonna judge that. At the same time they will also ask you questions on teaching methods. Okay, so please read this, which is called as the pedagogy. So teaching methods page, they're gonna ask you questions, so be prepared for that in this micro teaching wala component. It is not just that you're gonna present your PPT and you're getting done with it, not like that. You will be asked questions on teaching methods, ways of communication, etc. Then grand viva में तो भाई कुछ भी पूछ सकते हैं, मैं बता दूंगी. इसमें actually what they ask is basically the charts. Okay, the charts they're basically going to ask, and those charts basically includes regarding the OSPE, right? The HPLC chart, very important, HPLC chart. Then fish, then IHC. They may be giving you a case based scenario in which they'll be giving you the IHC and some clinical histories, some HP images or some cyto images, and then they'll be asking to corroborate all the findings and give an answer, right? Then immunofluorescence, then serum protein electrophoresis, and the flow cytometry. So all these are different kinds of charts that they may ask you in your OSPE or in your grand viva. So in my project, in my application, all these things will be covered. Whatever examples I have of the charts, I have included that in my application. But if you just write in your Google that serum protein electrophoresis, you'll be able to see how that is, what are the conditions in which there is a variation in the protein content that you can see. HPLC, obviously you will be having PDFs and all, so read that, flow and all. So this is basically your chart which comprises your grand viva. Grand viva mein they will be asking you questions, random questions, and also these charts and all, right? Now thesis mein, obviously from your thesis you have to know your title well. You have to be able to say your title without looking at that book, so you have to be able to do that. And then your objective, what findings you have got, what results you have got, what importance of your thesis, why you have done the thesis, how you have done the thesis, all you have to know basically, right? Apart from that, you have got 4 important questions which they may ask you for thesis. That is, number 1, what is an impact factor? Name some national and international journals that you're gonna do. Then what is peer review and what is indexed journal? Okay, so these are the 4 questions that they might ask you in your thesis station. So be careful, you have to know this 4 questions before you go for your thesis exam, right? Now histotechnics, there is a part called as histotechnics and special staining. Histotechnics, fixatives and special staining, and HNE staining. This part, okay, this part is very important and very volatile, and they will be asking you minute to minute things, the angles, what is honing, what is sharpening, all these things they'll be asking you. Okay, so you have to read this. Now there are 3 sources from which you can read this. Number 1 is the Manual of Histotechnics by Santosh Kumar Mondal. It's a very good book, you can read this. Then you can also go through this book, in which also you're going to get all these things covered, that is the basic and advanced lab techniques in histo and cyto by Pranab Dey. And then you also have another book which is the histopathological techniques by Ramdas Nayak. So these are the 3 books in which you're going to get all these things covered, basically the histotechnics, fixative, special staining, and HNE staining. Now there is another book which is the very famous book, which is the Bancroft. right? So from Bancroft basically we read the Histotechnics and all, but I am not asking you to read Bancroft because I think it is little difficult. These books are more easy to read, they are more easy to remember and reproduce. That's why I would ask you to read from these books and not to go with Bancroft. But if in the exam if you're asked which book you read, then you might say that I read from Bancroft, because these books are manuals, but standard book is a Bancroft. So I would ask you to rather take the name of Bancroft but not read from there, because I think it's a little bit difficult to read and reproduce from that. Okay, that's my personal opinion. Okay, so now what are the components of practical exam? Basically you have got 400 marks in practical. Now before I start, I want to tell you very clearly that practical mein tum kuch bhi ho jaye, you are gonna pass. Okay, practical mein you will be passed, 100% sure you will be passing in the practicals, in the MD exams. Okay, DNB no, DNB because you are giving the exam in a different institute. DNB mein pass depends on you, whether you are able to handle your practical exam well or not, that depends on you, and you have to have knowledge, you have to have proper system to do everything, and then only you can pass in your DNB. So DNB mein I can't guarantee you pass. Okay, so it depends on your efforts, depends on your performance on that particular day, because there is no one helping you out there. But in MD examination you are gonna pass in your practical exam, and that's a 100% pass rate for your practical exam. Now what are the components? Now first of all, normal histology, this you have to know before you jump for your practicals. You may not be getting direct questions from here, but it's very important to know this. Okay, you're gonna read it from Witters or diagnostic pathology or pathology outlines, maybe kahin dafa you're gonna get that. Okay, then autopsy techniques, museum techniques, very very important. You'll be reading this mainly from your PPTs that will be shared in your college. I also have the PPTs, and then you have got the Ludwig's book also, from which you can read the autopsy. इसमें heart बहुत ज़्यादा important है. Heart का grossing जो है is very very important. The grossing of the heart, I would request you to go through the YouTube videos as well, so that you get a clear impression. Obviously you're going to do that in your college also, you're going to do the first hand experience of grossing of heart in your college, but apart from that please watch the videos in the YouTube also, because it's difficult, and there are a lot of methods, 5 to 6 methods, separate methods for grossing of the heart. All the structures of the heart, the anatomy, the blood supply, the chambers, all this anatomy is very very important. So heart is very very difficult and important, so make sure you do that. Apart from that, the normal autopsy techniques like the Virchow's techniques, the Rokitansky technique, and all these things, so these are important. So autopsy overall is important, at the same time heart specifically you have to read it very very carefully. Then coming to grossing, it's a very important station. You have to sometimes identify the specimens based on their gross features. At the same time, you may also be asked regarding the procedure, the process of grossing, how it is done, what are the margins given, what are the sections given, how you have done the grossing, why you have done the grossing, and all the gross features, what is the implication of the gross features. The CAP protocols, very very important, the CAP protocols, राइट. सो ऑल दिस थिंग्स विल बी कमिंग अंडर द ग्रॉसिंग. तुम्हें ये अच्छे से ही रीड करके जाना है. वैसे एग्जाम में क्या होता है कि यू बेसिकली गिवन वन पर्टिकुलर स्पेसिमेन. बेसिकली इन द एमडी एग्जाम्स फ्रॉम बिफोर हैंड ओनली यू बी नोइंग व्हाट स्पेसिमेन you have, so you can read that particular specimen only, and you can leave out on the others if you feel, depending on your college, depending on what you feel for your batch. Now the clinical pathology में, clinical pathology by Kothalkar is a very very important book, right? So please understand that clinical pathology from Kothalkar जो book है, almost all the chapters you have to read from that. Clinical Pathology by Kothalkar is a very very important book for your practical. It is one book which you have to go through before your practical exam. Apart from your slides, it is this particular book. इसमें urine है, semen है, PBS है, everything, your ESR, PCV value, then your blood banks, okay, blood banking के techniques and all these things are very very important from the point of view of clinical pathology. So if I can just take you through the chapters, just once I wanted to see this. See what are the must do chapters from this book. So this is that book, Clinical Pathology by Kothalkar. Okay, so we have got the basically the second edition here. So I wanted to just look at the index and see all the topics which are important. Basic principles of lab medicine, very very important. Basically is the quality control and the Westcard rule, okay, which are very important for your viva. Then you've got the urine, then liver function tests. All the things I've highlighted, all these chapters are a must read for you. Okay, so liver function test, then the biochemical cardiac markers are also important. This is also important for your theory exams, right? Then CSF, then serous fluid and synovial fluid, thyroid function test. Then you have got the infertility, semen analysis, hematopoiesis, collection of blood, automated complete blood cell count, estimation of hemoglobin, PCV, reticulocyte count, platelet count, blood smear, RBC indices, erythrocyte sedimentation rate, bone marrow examination, hematology of infectious diseases, बहुत important है, malaria का life cycle and all important things. Okay, hematological changes in the HI is a long answer question, important है, ठीक है. Then lab test in bleeding disorders, lab test in thrombophilia, very very important, long answer question. Okay, then your flow cytometry and your IHC. Then this entire thing is important. This entire section of blood transfusion is important. Blood group system, blood grouping, collection, processing, all these things is screening, compatibility testing, the whole blood and blood derivatives, and the adverse effects of transfusion. So all the important chapters I have marked, and this is a very, very important book for your practical and for your theory. Some of the questions of theory also you're going to get from here, right? So blood bank ke liye I've already mentioned that you have to read the Kothalkar book, but I would also request you to read another important book, and that is the Manual of Transfusion Medicine. This is a very, very good book. If you can read, go through some of the chapters, some of the important areas. Manual of Transfusion Medicine by Ramdas Nayak is a very good book. There's another book called Macro for Transfusion Medicine, but it's a little bit tough. Compared to that, I found this book to be of much use for me. Okay. Then you also have got the Hematology by Kothalkar. You have the Hematology book by Kothalkar. Wahan par bhi you will be having chapters on whole blood, right? Whole blood, then the blood derivatives and the investigation of transfusion reaction, of adverse transfusion reactions. All these chapters are there even in your Hematology by Kothalkar, even in this book also, right? So for hematology you have two books, no? You have the Tejinder Singh and you have the Kothalkar. So Kothalkar is a short book basically, but it's a very, very high yielding book, very nice book. So blood bank ke liye you have got 3 books to read. Number 1 is your Kothalkar, basically the Hematology by Kothalkar. Okay, then number 2 basically is your Clinical Pathology by Kothalkar. ठीक है? So both these books are by Kothalkar. Okay, and the third you have basically got the Manual of Transfusion Medicine by Ramdas Nayak. So if you read these 3 things, you don't have to read everything from everywhere, but just go through the chapters. You'll be able to figure out which is important for you. All the chapters are not important, but some of the chapters like the Kum test, the blood grouping, all these things you have to perform. So all these basic concepts has to be completely clear. So for that you have to read these books, okay, and also go through the YouTube videos, how to perform this in your blood bank, visit the blood bank and all, right? So that's how you can do this, and this is all about the blood bank. Because you have to do this Kum test, you have to perform the blood grouping, you have to perform the urine test. So all the practical things you have to perform. Apart from that, you also have to perform the PT and the FPTT and the hemoglobin estimation. So all these things you have to perform. So that's why I'm telling you all these procedures you have to know. In your college also you're going to practice. So that's it, right? So for practical hematology procedures, you have to go through DESI for the standard procedures. So from DESI you will be getting that, watch some videos, and all these things you have to perform on your own. Apart from that, instruments if you want to go through, you can go through P. Chakraborty or any other practical book that you want. It will be given there, not very important from the perspective of PG examinations. So charts I've already mentioned. Now slides के बारे में मैं ये कहना चाहती हूँ. Slides में you have got the systemic, cyto and hemat, and you also have got the organisms. Organisms में must do organisms are malaria, filaria, fungal infections, Myrmecia versus molluscum contagiosum, LD body, neurocystic sarcosis and hydrated. All these things are a must. इसमें से spot diagnosis they will be giving you. Okay, one organism or the other will be there, definitely there for your exam. So make sure to recognize them and to read about them before you go for the exam. Okay, so apart from that, systemic की slides, now before the exam I would request you to revise the slides. Now slide revision के लिए ऐसा तो कुछ book है नहीं जहाँ से you can revise the slides, but what you can do is that you can go through the pathology outlines. You can go through the net. Okay, like in the internet you'll be getting some slides, because all the slides are not representative. So I can't tell you कि हाँ यहीं से तुम पढ़ लो. But Bethesda में काफ़ी सारे अच्छे images दिए हुए हैं Bethesda में. ठीक है, then pathology outlines में. Okay, then you have one book called as the ACE histopathology or ACE cytopathology. Okay, so from all these books you can have a glimpse of basically your slides, but I would request you to have a list of the slides from beforehand, and before your practical, between your theory and practical, you're going to have 7 days ka gap, minimum 7 days ka gap you're going to have, and in that particular time I would request you to take up a particular slide and search that in the internet and see some of the images from that. So for that you have to have a proper basically list of the slides. So once you have the list of the slides, you can just open one slide in your in your internet, in your Google, let's say from pathology outlines, you can just write that and visit this site, and you can just see the images, the IHCs and all, just go through that. Okay, that will be a revision for you. So like that you can do. Okay, all these things are covered in my application, but I am telling you other ways that you can do it without a help of anybody. Right, on your own also you can do great, and that's how I'm telling you that these are the ways that you can revise without the need of anybody else, right? So now this I've already mentioned, histotechnics, special staining, and biopsy ke liye, yes, liver biopsy, kidney biopsy, muscle biopsy. This is very, very important. PPTs are available for this. You can go through those PPTs. All these biopsies are important. राइट सो प्रैक्टिकल में ज़्यादा है नहीं, प्रैक्टिकल में ज़्यादा स्ट्रेस लेने की भी ज़रूरत नहीं है, बिकॉज प्रैक्टिकल स्लाइड्स दिस पार्ट दैट आई मेंशन ना, दिस रिविजन, दिस पार्ट द एंटायर ईयर यू आर ओनली प्रिपेयरिंग फॉर दिस, योर एंटायर ईयर. सो दिस यू शुड नॉट टेक टेंशन बिफोर द एग्जाम. इसके लिए पूरे साल तो मेहनत कर रहे हो, राइट. सो बिफोर द एग्जाम फोकस ऑन ऑल द अदर एस्पेक्ट्स ना, क्योंकि स्लाइड्स तो तुम्हें वैसे भी पता है, right? And obviously bone marrow slides, don't forget to revise. So hematology mein you also gonna get bone marrow, not only PBS, you may also get bone marrow. So make sure bone marrow biopsy and bone marrow aspiration you are well versed with the slides. So all these things slides ka वैसे भी practice, you are doing it all around the year, so there should not be any problem in the exam. And see, if you don't figure out, if you can't figure out anything, please write. You can, if you see that the cells are, let's say, malignant, okay, the cells are malignant, the cells are not looking good, but you don't know what it is, you can write metastasis, right? In my exam only I got a slide, like for example it was a bone marrow aspiration slide, and the cells were foreign and the cells were basically malignant only, not very good looking, but not able to figure out what is that, so it was basically a metastasis. So if you can't figure out the origin or something like that, you can just write metastasis, that can also be your DD, okay? So keep it in mind. And this is all I wanted to mention about the practical exam, because practical mein the things are not that vast. Theory is more difficult than practical. Practical mein you have that satisfaction ki haan main pass kar jaungi, but the problem is the practical syllabus is huge, and for that you are practicing the entire year, okay? So don't worry, these are the things you can revise. Make sure to revise, to actually keep these things at one place. Make folders in your phone or whatever sources you're reading, your tab, your hard copy, however you're reading, make sure to keep these things at one place, so that before the exam you can just revise these things and go for the exam. So if you have any particular query, you can mention down in the comment section below. I would request you to join my Telegram group, and I would take your leave today and meet you in my next video. Till then, keep smiling, keep studying, and thank you for watching.